Hashimoto's thyroiditis is one of the most significant causes of hypothyroidism. The difference between other risk factors of hypothyroidism include Hashimoto's being an autoimmune disease, indicating that rather than an external factor, this disease is a consequence of the body's inability to differentiate between own and foreign cells, leading to elimination of normal healthy cells. The pathophysiology of this disease can be interpreted by the production of anti-thyroid antibodies that begin to attack thyroid tissues, causing fibrosis, which progressively builds up scar tissue in place of healthy organ tissues, causing dysfunction in the thyroid gland due to the consequential scar tissue remodeling. The detection and diagnosis of this condition can be detected through pathology screening via identifying the presence of relevant indicators. With reference to hypothyroidism, the presence of low T4 levels, also known as thyroxine, is a hormone released by the thyroid gland that upon metabolization and conversion regulates bodily functions such as metabolic rates, muscle control, and brain development. Decreased levels of this hormone would indicate its decline in function, causing the lack of production of T4 hormones. The decreased levels of T4 would then correspond with increased levels of TSH, thyroid stimulating hormone. This hormone is responsible for regulating functions within the thyroid gland. Therefore, the detection of low T4 levels would trigger the continual release of TSH hormones. The presence of lymphocytes are also highly indicative of this disease, as their presence represents the autoimmune nature of the condition. These antibodies are responsible for counteracting foreign cells, and due to the characteristic of Hashimoto's disease having the inability to differentiate foreign cells with healthy cells, the detection of these lymphocytes indicate their immune response activity. Hashimoto's thyroiditis can be managed through hormone replacement therapy through medications. Levothyroxine is a commonly used medication utilized in the treatment of hypothyroidism patients. The drug classification of this medication is a replacement regimen, as in a synthetic hormone replacement. The mechanism of action of this drug involves restoring the absence of the T4 hormone, further restoring functions that have halted due to the lack of hormone receptors binding. Indications of this medication include hypothyroidism, therefore, patients with Hashimoto's thyroiditis. Nursing considerations relevant to this medication would include drug compliance, which can be managed by ensuring adequate education is provided. This would include consumption on an empty stomach with a minimum of 30 minutes prior to a meal. Consistency in the time period the medication is taken to ensure regularity in hormone availability within the body. Drug interactions that will prevent optimum absorption. Monitoring T4 and TSH through regular lab screenings would also be beneficial with this drug, as it would indicate the effectiveness of the medication, as well as identify whether alternative therapies should be considered with lack of effectiveness. With reference to the case scenario of Rebecca, who was diagnosed with this disease and presents symptoms of weight gain, fatigue, dry skin, and hair loss, it would be beneficial to monitor and reassess after regular consumption of the medication whether the symptoms have alleviated, to further assess the effectiveness of the drug. The previous symptoms are all clinical manifestations due to the reduced hormone production, which in turn is impacting the function of metabolic systems, causing weight gain, energy level loss, and growth cycle disruption. A weight chart and documentation of the symptoms could be assessed as a baseline and recorded for comparison in further checkups.